Hello, everyone, and welcome back to another episode of Our Own Devices with Nandagopal Rajan. And again, it's me, and we have another great guest with us this time. It's Punit Singh Soni, who is the CEO and founder of Suki.ai. Punit has worked with companies like Flipkart and Google and comes with a wealth of experience into a field that is relatively new, I think, and I and but has a lot of opportunity. Punit, welcome to the show.
Thank you. It's a pleasure to be here. Appreciate the introduction.
So, Puneet, health and AI, I, for instance, have been hearing a lot about it in the past 3, 4 years, and it has a lot of scope. We have seen some cases where it's been really revolutionary. So, if you could start by introducing, what do you plan to do with Suki AI?
Yeah, happy to answer that. The thing with AI in general is it's a much misused word these days. You know this as much as I know. Across Silicon Valley and Bangalore, right now, everybody thinks they're doing AI. A
And
dog
in
walking
Noida,
app actually has AI,
also in Noida.
right? In Noida. Across all of the hubs of technology, there are all sorts of ideas, and every one of them has to have the tag with AI nowadays. AI is just a technology. It can sometimes be speech recognition, it can sometimes be intent extractor, it can be deep learning algorithms used for learning how to machine learn a particular process and automate them. It's just technology at the end of the day. The primary question to ask is, what has tech done for healthcare in the past? And in my humble opinion, there have been attempts to make healthcare more seamless with tech, but it's mostly backfired. If you look at our healthcare systems today, the digitization has actually not led to the burden decreasing. And US is case in point. There was a world where people were writing when they would meet a patient, write down everything, all the notes, and put it in a file, etc. Then we said we'll digitize it. And now all the doctors do is they keep checking boxes, clicking things, use 1880s, 90s style software in which they type stuff. And you end up actually creating data clerks out of these doctors, where 2 to 3 hours a day, they're actually sitting in front of a computer doing these things. This is the world that US has gotten to because technology was there to try to help. And I think we have to avoid that situation in India because India now is at a place where it's going to go from this paper based setup to a digitized setup. So, one key thing we can do is actually minimize the mistakes that other developed countries have made. So, to that point, what does Suki do? The most influential constituency in healthcare is doctors. They are burning out because of a significant amount of administrative burden, regulatory burden, liability, pandemic, the doctor patient ratio, which only is getting more and more exasperated by the day. We believe that you can use voice, and voice is a technology to reduce the amount of administrative burden these doctors have so they can focus their energies on things that they're trained to do, which is clinical care. So what Suki is doing is basically building a digital assistant. Think of it like a Siri for doctors. And then also opening all of the underlying voice technologies that used to build that digital assistant as a platform to other healthcare tech companies so that we can reduce the amount of interaction doctors have to do with technology and increase the amount of interaction doctors have to do with patients. That's the focus of Suki as a company.
So does this mean it's like a Siri or an Alexa which is there on a doctor's computer or in his room and is listening as he's having a conversation, or does he have to speak directly to this entity?
So the flagship product of Suki is called Sookie Assistant. It is like a Siri.
Hmm.
And by Siri, it means it's a command and control system. Okay. The prior generation of voice products, you had to say everything, you had to click places, say everything, it would show up, the words will come up, and you'll move on. But in the next generation, you can just tell it what the intent is. So, a classic example is, imagine you're a surgeon and you basically have now decided that a person has to go through a procedure. Typically, the surgeons will consent the patient to that procedure. To do that, they usually type something like, I did a risk and benefit analysis of this particular procedure, and the patient has consented to it. Now, that was the prior generation where you would have to say all these things. With Suki, you can just say, Suki, insert my typical surgical consent. And what Suki does is it knows what kind of consents you write in the past, and it can actually automatically generate that and put it in the right place. Or you can say, Suki, what's my schedule like? Hey, start a new clinical note. Prescribe doxycycline 5 milligrams over 6 weeks. Insert this particular issue, submit things, and then the whole workflow would be automatically done. So, this kind of a command and control system where doctors have an assistant at their disposal to do all the things that they would have done by hand earlier is basically the core purpose of the Suki assistant.
So it's fascinating actually, but to come back to the point of AI being used and misused so much, like and I keep saying AI comes in. I keep saying that AI comes in when human intelligence goes out of the room. But AI can actually also give a lot of intelligence to the doctors, right? Like, so do you have an
Yes.
intelligent layer also where, let's say, the system can tell them or tell the doctor that, hey, you already have 5 patients which have had this kind of a trend, and you prescribed this thing.
Yes.
So does it make life easy for the doctors in that sense?
Exactly. And this reminds me, to be honest, of a anecdote around IBM's Deep Blue. Uh, I don't know if you remember this time, but the Deep Blue machine had shown up. And I may get some of the facts off, but the general point will be made. It showed up and it could play chess.
Yes.
And so they had this big game where they had the champion, the Kasparov playing against Deep Blue. And Deep Blue beat Kasparov. And so there was a press conference, and everybody asked Kasparov, they said, so that's it. There are no human players required in chess anymore because the computer will beat you. And he said that the computer will beat me, but give me a computer and I will beat every human and every computer ever. And the key insight there is artificial intelligence can provide a significant amount of assistance.
Yeah.
It's an assistive technology so that doctors can focus on what makes humans unique. Our creativity, our human connect. When you go to a doctor, you're not talking to an algorithm. They're assessing you, they're looking at your temperature, your vibe, your tonality, and they're having a human connection. And then, along with that, if all the grunt work can be taken care of by the AI, then they are freed up. And typically what we have seen in places we have deployed Suki, 50 to 70% decline in administrative work for doctors. So on an average, we are seeing these doctors end up getting 1 to 2 hours a day back. They may use that to go back home to their families. That may help with their retention. Or they may decide to see a couple more patients. That will help all of us because we get more patient care. Doesn't matter how you do it, but an assistive technology can actually make sure that doctors don't have to do this cut work that they have to do. The first skill of this assistant is note taking, clinical documentation. You talk to it, it will do the note and put it in the right place. Then we added a second skill called coding. What it does is it takes all the information from the note and sends it to insurance so that insurance can pay you.
Mm.
This is actually an area where a lot of people spend time have manually kind of sending information over, and now it actually automatically does. What we found is that when people were using Suki, because the note quality is comprehensive, their claims denials from insurance went down, and there was a 24% increase in actual revenue created for the health system, which is actually good because you're capturing what you actually did effectively. The third skill, which we just debuted 2 days ago, is this idea of data retrieval. So now users of Suki can say things like doctors can say, you know, uh, what allergies did this patient have? What orders, what medications is the person on? So now, if we can answer that question, what vital signs, what are the vital signs for this person? The leap from there to a place where if the vital signs is out of bounds and anomalous, to put a red mark next to it and say, did you notice that this person's A1C levels are elevated over the last 3 months? Is not a big leap.
Yeah.
So, to your point, going back to the original question, this area that you're talking about is called clinical decision support.
Mm.
The reason you have to tread very carefully here is because when you make superfluous suggestions to the doctor, you can they'll get annoyed. They know clinical work better than anybody else. So you have to gain credibility. So first you do note taking, Then you help them with their insurance workflows. Then you start providing access to data. Then you start pointing out some data that's anomalous. And then it's not a big leap from there to say, this person has cardiovascular issues. Are you sure you want to provide them with a particular kind of medicine which might interact badly? That every single thing that I'm talking about is a $10 billion total addressable market business, and also a huge space that doctors need a lot of help today. This is the journey of Suki, the digital assistant, and the speech platform we're building.
So it is a voice assistant. So what do the doctors interact with? As in, okay, it can capture my voice and take notes. So, but if it is suggesting things to me, is it coming as a voice? Is it coming as a voice assistant there, or is it something that sits on top uh, of whatever patient management system or something that the doctors use, or
Right.
does it come as an entire package that you're giving the entire system to the doctors along with the voice assistant?
Yeah, very good question. So basically, Sookie Assistant is available on iOS as an application, on Android as an application. It's available in a website, so you can go to app.suki.ai and log in and start using it. It's also available in Windows as a native application. And the idea is it's a assistant that complements your existing stuff. So whatever you're doing, you can do. We will plug into your medical records, pull in all the data, and have it available to you. So most of our doctors, they're casually walking around on their phone and they're saying, okay, well, I'm going to see Jane Roberts. She's 37 and she's got hyperkalemia. Create a new clinical note, prescribe this particular medicine, send it to the EMR. And so it's basically a mobile application and a web application that's available to all the doctors and nurses on the go that they can use.
So, if we go a bit beyond Suki, so how do you think AI can really plug the gaps in a market like India? If I can just give you an example, at the time of COVID, when cases were all around the place, we could not access hospitals because, like hospitals were overflowing, and you didn't want to risk yourself, by going to hospital. And that is when a lot of
Yeah.
us started, banking on online services to get the first interaction with the doctor. And a lot of us realized that those interactions were almost scripted, because everybody was getting the same kind of
Yeah.
suggestions, and the conversations were similar. And maybe it could have been taken over by an assistant, like a computerized assistant.
Yeah.
It didn't need a doctor, even however junior that doctor might have been. So do you think, in future, in a country like India, where the doctor to patient ratio is so skewed, you do you think something like a voice assistant, or an artificial intelligence system, can take away the first layer, and say that, hey, these are people that we actually need to refer to a doctor, and maybe some people we could just immediately give recommendations based on the condition that they are in?
Yes, I think the answer to that is yes, but carefully.
Yeah.
Okay, and let's think about India for a second. The problems that US has are in healthcare are very different from the problems India has,
Yeah.
but the result is the same. Both places actually have really burnt out doctors. The patient doctor patient ratio is very poor. In fact, the nurse patient ratio is even more poorer in most places. And in India, access is a problem, but there's also a problem that you have an impending digitization of health records that's going to happen soon. In US, the problem is that when they were digitized, they were not made interoperable. So now all these records are in these silos where they don't talk to each other, and therefore you don't get innovation is stymied, because anything that has to be built has to work with a lot of different kinds of underlying systems. So first, in India with Ayushman Bharat, with the idea that you can actually own your own medical record, digital medical record that's associated with your Aadhaar, and have an API that you can use to push and pull data into it. If we can build that in the right way with fire based interoperable APIs, make sure that there's a level playing field for everybody, make sure that the consumer has ownership of their medical record, not anybody else, that would actually allow you to avoid the mistakes that US, for example, has made that they are now trying to unwind. So step one is to make sure that the basic infrastructure, just like what UPI did for fintech, has to be done for the Indian ecosystem also. Now when that is done, then a product like Suki deployed in India will have a different impact, because in this place it's possible to actually go beyond it just being a assistant. that actually works with a digital medical record. It could actually become your digital medical record also. You could use the voice assistant then to actually query it directly about all the things that the information it has about you. From going from there to a place where it's also a product that can be used by patients is not a big leap. And I believe it's actually ripe for a place like India. This is one of the reasons why we are here in India, by the way, because we believe that you have to start entering a market at least 2 to 3 years before the market's ecosystem will be ready for you. And I believe in the next 2, 3 years, we're going to see things happen in healthcare in India that have already happened in fintech in India. And when that happens, India will become, in my opinion, the most interesting healthcare market for the sheer volume of population and also for the needs that the market has and the access issues it has. This will become probably one of the most interesting markets to be in. So to kind of summarize, the point you made is very valid, but there is a journey to get there, because the first thing to do is to actually make sure this digitization of records happens and everybody has ownership over them in the right way. Then you can use that data to start providing suggestions and or helping with access issues.
Puneet, in comparison to the US, for instance, India is a market where you have different levels of maturity when it comes to the healthcare system. You would have a Kerala or a Delhi, which is maybe at par with the US in many ways, and you'd also have parts of UP or Chhattisgarh where it's really hasn't picked up. And you're talking about maybe a 3 year time frame till we get to a point of digitization. Do you think this is also the right time? Then maybe we need to standardize things in the country when you're talking from a government perspective. Are you having those conversations with those stakeholders? Because if you're talking to doctors, it's at the end point, but do you really need to have conversations at maybe a health ministry level to say that, hey, we need to put in these standardizations so that we don't fall into the problems that US had with these silos?
Absolutely. And in fact, I would almost argue that we're a few months too late because of COVID. We
Yeah.
couldn't actually make our presence here earlier. But now, we are here. And one of the key things I'm going to work on over the next 6 to 9 months is actually put together a small team of government relations people, start talking to healthcare, health ministry, start talking to the people who are working on Ayushman Bharat. Because, see, I want to make this very clear. We are not doing this because we want to benefit Suki.
Hmm.
Suki will be benefited if there is an interoperable, patient owned system that is democratized, where data can go in and out in a privacy sensitive and secure manner. Suki will be fine. What is important to me is that India actually adopt those things in its initiatives that it's working on, the application that it's building, interfaces it's building. So we're going to be spending a lot of time trying to get to the right people in the ministry and in the people who are driving this, because these are the goals that we have and we want to get there. And that's one of the reasons why I'm talking to you. The idea that I have a 50 people team here and I can double it to 100, I don't need to go around and do press for that. The reason I'm actually having these conversations is because I really, really believe India is poised to miss and skip the mistakes that have been made in digitization by other developed countries. And right now, over the next year or so, key policy decisions will be made which will make this happen. So, through you and through other conversations, I want to make sure we get a seat at the table, because in the next generation of healthcare tech companies that are coming, at least in US, we are probably one of the front runners, and we want to make sure that we are there in India also in the same way.
It might sound slightly weird, but do you think the pandemic sort of helped a country like India, figure out this entire, data flow, which you need to have from, let's say a village level coming all the way up to the health ministry in Delhi? Is it something that we've been able to figure out because of the pandemic? And is that kind of a pipeline, a network of data, going to help you in the future?
Yeah, very good question, and it's obvious that you've been thinking about this quite a bit. The interesting thing with tech moves very slowly for decades, and then change happens within a week. Like, you will kind of be sitting there saying, well, will things ever make a difference? Will change happens, and then in 1 week you get progress of 10 years, and people think, oh wow, things changed overnight. But all successes like that are built over decade. It's overnight successes over decades. And I believe that what the pandemic did, and US also and India also, in both places, it actually forced us to make the choices for which infrastructure and intent was already there, but perhaps we were not ready to accept some of them. And so the digitization is critical. Making this, normalizing this data is critical. Finding ways to be able to do it over online setups is going to be very critical. Using voice to do it is very critical, because remember, how many people can sit and keep typing if you want to really democratize stuff? The other thing you need to also think about is that where mobile was in 2005, 2006, and I think mobile, and I remember this, I built Moto G, which we brought here, and it actually kicked off the Android revolution in the country. Mobile is a key reason for the leapfrogging of India into the internet era, because then every single person started using this device and had access to all that the device had to offer. Voice is the mobile of this generation. Where mobile was in 2000, 2005, 2006 is where voice is today. In a few years, people are not going to be worried about clicking and tapping and typing things. They will just casually talk to this device and it'll be able to do things for them. And so, to me, this confluence of pandemic, potentially pandemic influenced push, general digitization of healthcare, and the fact that voice is the next user interface of our generation is where companies like Suki sit. We are actually effectively, if we do things right and execute well, will end up becoming the next big company, technology company in this space, because this is the confluence in which all the exciting things are happening right now.
I have one last question, Puneet, and maybe a little bit trivial. You also have this layer of data that is happening at the user level because of so many very affordable devices that people are using now. You have everything from a simple band to an Apple Watch, which collects all types of data about users. What we have been calling the quantified self. Is there a layer,
Yeah.
or is there a need for this data also in the system that you are envisioning?
It's a good question. The problem with the quantified self is that it's like 90% of the rest of our life, right? When
Yeah.
you go to a doctor, the doctor actually will document something. That's basically the time you're sick. The rest of the life is where all this data sits. The
Hmm.
problem is that all of this data is very fragmented and it's not very easy to create insights out of it. Now, a lot of companies try to give you apps, where fitness apps, etc., where they will put together some insights to look at it. But so far, they're at a very basic level. But what you get, for example, from a doctor who actually sits and says, this person is of this age, these are the issues, heart murmur, we have seen this problem, etc., is so rich that, first of all, being able to even make sense of that data will completely be a step change in healthcare. So think about it for a second. Why did we decide that clinical documentation, note taking, was the first skill of this assistant? The reason we did that is because doctors are burning out because they don't want to write notes. But more importantly, all data in healthcare is created by doctors in these notes. So what Suki has access to, and in the time that I've spent talking to you, at least 5 to 6, you know, patients have been and doctor encounters have happened with Suki being used across the country and across all sorts of different specialties. Every time that's happening, I'm getting data, structured data in a structured format from the horse's mouth before it even goes into any system at the front end. If I can start making sense of that data to start answering the kind of questions you are talking about earlier in this podcast, that would be a huge leap for healthcare. Quantified self is like gravy. You know, this is the first step, is to actually even make sense of the existing structured data we have, which we don't do. We do a very poor job of, by the way, today.
Thank you, Puneet. A fascinating conversation on how healthcare in India and the rest of the world is changing thanks to technology. Thanks for being on the show.
Thank you.
Yeah, thank you, Puneet. All the best with what you're doing. Um, and this is Nandagopal saying bye again. We'll be back again next week with another guest and a lot of insights. We are everywhere. You listen to your pod.